शेअर करून ना उसके पहिले अनिल मी मैडम शेयर उसको पहले थांबा पहले बोटॉक्स है ना उसको मैक्सिमाइज करना उसके बाद
वो यहाँ पे वो आइकन नहीं आएगा जो वो फेस वाला आता है जूम का
आएगा सबका ना कोई दिखा दो
सबका और इवन मेरा भी
वो करना पड़ता है तुम पे आपको नहीं देखने को मिलेगा ब्रॉडकास्टिंग होगा ना चाहिए तो किसके मोबाइल चालू करके रखो आप भी देखोगे तो पीपीटी भी दिखेगा जब स्क्रीन शेयर करते हैं ना वो निकल जाता है
ओके
ऐसा ना तो ये आपको दिखेगा लेकिन ब्रॉडकास्ट होगा डीपीडी और आप दोनों
ओके हाँ वो तो ठीक है बट अभी मतलब इसमें मैं भी मुझे दिख रही हूँ वो भी दिख रहा है राइट ना ठीक है
फिलहाल ये ब्रॉडकास्ट आवाज
Very good afternoon, Dr. Nishita. Ma'am, can you unmute yourself? I'm not able to hear you.
Yes, hi Dhruvi, how are you? Good afternoon dear, how are you?
I'm doing fine, ma'am. How are you?
So are you a dentist also?
All good.
Yeah, are you a dentist?
Yes, ma'am. I'm pursuing my 4th year degree. I'm pursuing my 4th year in D.P.D. I'll soon be a dentist.
Oh yes, nice. Good. So, how do you find this cosmetology and cosmetology and cosmetic dentistry? It's a new branch, all in one, no?
Yes, ma'am. Totally, absolutely. And also being, associated with the pageant, I really feel that aesthetics is very important. Not only, for the pageant, but also for, in a professional world. And I personally really want to know more about it. So I'm really very excited.
Okay.
And also the viewers are very much excited, I'm for sure.
The topics are so very good. These are all the number one treatments in the world. The Botox and fillers, they are number one treatment, aesthetic treatments done in the world. In US and UK, and it's so common. Everybody, they all get it done. In India, it's not so very common because we have only celebrities who gets it done. But currently, I get all even middle class people now to get it done. and it actually changes
That's
your
a
life,
great thing.
and your confidence is superb with the procedures we
Yeah.
do. I've just done one Botox in the morning and came. So it's
Okay.
really nice, interesting, very good. So
I'm
how
really
many
looking
people
forward to
are
that,
you
ma'am. Maybe
expecting?
I'll come.
Yeah.
Ma'am,
So
I really expect minimum of 100, but it can be more than that because the registrations are beyond 500.
okay,
So
wow,
keeping in
nice.
mind the time right now, so total of registrations we got were 598, around 598.
Okay.
But as it is Monday and people will be busy in the lectures, I expect at least 100 students to log in. So we will wait till 4 o'clock as I have given them the time of 4 o'clock. We'll
Okay,
check all
perfect.
the technical glitches.
Right, right, right. So I'm audible to you perfectly.
Yes, ma'am. Clearly you are audible and visible. Everything is fine.
Nice. So I just got my Botox done. I do my own Botox.
Oh, that's great.
I inject myself. Maybe in India, hardly any doctors who can inject their own Botox, but I do it. So I train doctors like you, doctors, dentist doctors, and M.B.B.S. and plastic surgeons and dermatologists.
But
I
ma'am,
give them my face first.
Oh, is it?
So my
That's a
doctor,
huge
my
risk.
trainee doctor only. Last week I showed her on myself. On one side I injected myself, and second side she had done it.
That's a lot of trust needed over here, ma'am. And I'm sure under your guidance they might have excelled in that field, and so that you're giving
No,
them
because
the role.
basically you should know in Botox and fillers, you should know your anatomy well. If you know your anatomy well,
Yeah,
you cannot
true
go
that.
wrong.
Yeah, true, totally. Ma'am, I have one question. Not a question, just a doubt. Is Botox and fillers, allowed in dentistry? Is
Of
it
course.
patent to do?
You know the best name in India, who is the biggest injector
No, ma'am.
in India? He is your dentist,
No, I have no idea.
Dr.
Oh,
Thomas,
is it?
Dr. Mohan Thomas. He is from Cosmetic Surgery Institute.
Okay.
He had done dentistry in India, and then he pursued some masters in dermatology or cosmetic surgery in USA, and now he is the one who is injecting all the celebrities also.
That's great news because I would really want to excel in this field ahead. And with your
Of
guidance,
course.
I'm sure I will really do great.
Yes,
wonders.
yes, most welcome, most welcome. Anytime I can really teach you all, no problem at all. And
Also, ma'am,
when I really wanted to learn all this, Dhruvi, there was no one who was teaching. I had to go to different part of the world to get my training done.
I can understand, ma'am. The technology available right now was really not available
Correct.
earlier, and the efforts you took, we can really see over here. And so we have got 600 registrations to see this beautiful thing from you.
No problem at all. My pleasure.
Also,
My
ma'am,
pleasure.
I would really like to thank you on the behalf of whole IADS team for helping us at the very needed moment where we could have
No problem
literally
at all.
fall apart. But thank you so much, you supported us.
No problem. So, tell me about this IADS little more in detail.
Yes, ma'am. Ma'am, IADS is a branch of International Association of Students, which is under FDI, that is Federation Dental International.
Right.
It is the biggest branch of dentistry. So, in that, this is a student wing. So, only the students of India are running this association. So, as it is a branch, comes under the main branch of International Association of Students. So, it is divided into different countries. For example, for this event, we are associated with Egypt Association of Dental Students.
Okay.
So, in India, it is also further divided according to the state-wise.
Nice.
So now, this event is via the IADS Maharashtra team of students. But yes, we have received support from the national heads from the other states of IADS as well as the national heads of EADS. So
Perfect.
this is all about IADS.
Nice. So then I think we may also get some students from all over the world to learn this.
Yes, ma'am, for sure. Yeah. Students from Egypt are already registered for your lecture. They will be viewing you live from the YouTube.
Wow.
And they will be posting questions on the YouTube chat box, and we will be posting it on the Zoom chat box so that you can answer all of them.
No problem.
And we will be providing your personal details, for example, the contact and email ID, so that if in case in future they need to approach you, they can surely come and do
Okay,
that.
pakka. No problem at all. That's good.
Yes. Ma'am, I would request you to just give me 5 minutes so that I can contact with my team and then get started in just 10 minutes.
Go ahead.
Yeah. I'll get back in 5 minutes.
Sure, dear. No problem at all.
Thank you, ma'am. Excuse me, ma'am. Ma'am, can you unmute yourself?
Yes, Dhruvi, bolo.
Just a minute. Ma'am, we have got a total 47 students logged in right now. So we will
Okay.
wait for some more time, 5 to 10 minutes.
No problem.
Ma'am, we have got 62 people right now. Shall we wait for 5 more minutes? Ma'am, can you unmute yourself?
Okay, that's fine.
Okay, ma'am.
सर का मोबाइल लेके दे तो म्यूट कर सर का मोबाइल. उठ गए. अच्छा. इधर ही बैठ जा. कोई इधर उधर आवाज वगैरह आ रही होगी तो देख लेना.
Ma'am, we have got 93 students logged in. So, do you wish to wait more or should we start? Ma'am, can you just unmute yourself?
Let us start now if it is okay, because then I will have some patients waiting in there. No?
Yes, ma'am.
Okay?
Sure, ma'am. Not a problem. We'll start with it. Yeah, sure. So, yeah. Ma'am, I'll just give an introduction to the students and then I'll
Sure.
give over the mic to you. A very good afternoon to one and all present here. This is Nishita, Scientific Head of IADS Maharashtra. And today we are IADS for her insightful lecture over here. And I would like to introduce her by giving a small gist about her. Dr. Nishita Sheth is a doctor and professionally qualified dermatologist, esthetician, cosmetician, and weight loss specialist, having vast experience. After M.B.B.S, Dr. Nishita did diploma in dermatology from Cardiff University, Mount International School of Cosmetology, UK. This was just a small gist, but there's too much to know about ma'am, and I would like ma'am herself to tell us more about her. So, ma'am, can you just take over from here?
Yes, yes, yes. I welcome everyone here in the live webinar session of IADS with DNCC. So I've been given a topic about Botox and fillers. Botox and filler, I can talk non-stop whole day, whole night. But I have given a limited time period for the same. So let's just start. Okay, I'm Dr. Nishita Sheth. I've done my practical dermatology from Cardiff University, UK after doing my M.B.B.S. and practicing since last 15 years now. And we
Ma'am, please unmute yourself. You have been muted.
So
Yes,
I
ma'am.
have
You can go ahead.
Okay, I have done my M.B.B.S and then I've done my dermatology from Cardiff University, UK. So, and we are having a chain of cosmetic clinic. It's in the name of DNCC. That's Dr. Nishita's Cosmetic Clinic. So why dentists are entering into cosmetic field? I just want to give you a very small insight about it. It's the most lucrative field about the cosmetic dentistry, you say, or cosmetic, aesthetic industry. There are so many people entering from all over the field into this. Why? Because this is the number one branch right now in any medical field, and it's the curriculum or the studies or what we teach is not a curriculum of any university or any books. So when I wanted to learn about this Botox and fillers and everything, I had to go to different part of the world and get my knowledge, and I had to do it. Dhruvi, is everything audible to you?
Yes, ma'am. You're completely audible.
Okay, okay. So let's start with Botox and fillers. Why I chose this subject, Botox and fillers? Because this is also related to your face and neck, where you are actually, when you're doing your dentistry practice or as a dentist, if you see some lines, you can always advise your patient to get the Botox done. Or also, if you are saying you are on the face all the time, so when you get that kind of patient, you can always suggest them to go for the Botox and filler treatments, which are these treatments are basically you need to know about your anatomy well only. Baki, it's not that difficult, but if you know your anatomy well, you can get your Botox, treatment trainings easily. So let's just start on what is Botox and what is fillers. Okay. So Botox is a name given to botulinum toxin. So we used to learn in our medical part that Clostridium botulinism, and it used to give us, in poisoning. If it is given in excess amount, it is a poison. Basically, it's a toxin. So let's just go through one by one what is Botox and what is fillers, okay? Okay, so let's just see what is starting off with Botox. We will also learn neurotoxin pharmacology, how you have to dilute and storage. And I will give you some technical tips how you can do the Botox on the face. So cosmetic enhancement of the upper face, that's a globular line, frown lines. So these are my globular lines. If you all can see, these are my globular lines, okay? Then comes the crow's feet. So when I smile, I get some lines surrounding my eyes. That's called crow's feet. And the third one is forehead lines. So globular lines, forehead lines, crow's feet. So Botox is basically for upper face and filler is to fill in the lines on the lower face. I will also run through potential side effect of the Botox. Then we can have a workshop on that. Okay. Why learn Botox? Botox is now the most common aesthetic procedure performed in USA. Basically, in USA, every single lady or a gents get it done to also get a very good, position in the job. And there are Hollywood and Bollywood and now Tollywood, and everybody gets it done. So we all have that one thing in our mind that okay, Botox is done only for the aging face. No, it is not true. Botox can be done as early as 20 to 25 years also, just to give you a glow on the face. Also, we are doing mesobotox. It's called mesobotox. So 1.6 million Botox procedure were performed in US in 2001, making it the fastest growing procedure. So that is the fastest growing procedure in USA. Then comes the chemical peels, then comes the collagen. Collagen is a filler, and then microdermabrasion and the facelift. So these are all botulinum toxin is produced by the gram-negative anaerobic bacterium Clostridium botulinum. 8 serologically distinct botulinum toxin exists, designated as A, B, C1, C2, D, E, F, and G. Types A and B are used for medical indication. Exotoxin A is more potent than B. Then comes the mechanism of action. So botulinum toxins are neurotoxins. So many of the time when I see my patient and they feel, okay, doctor, are you going to paralyze my face? So that's not true basically. So they are neurotoxins. You have to tell them that it is only going to relax your muscle. By relaxing the muscle, you are going to get the skin tightening effect. So our facial muscles are very superficial. So when it is superficial, if I just put in some Botox, botulinum toxin, it is going to relax my muscle. That is all these muscles over here. We will go through what all muscle comes on the area where we are injecting. Okay, they inhibit the release of acetylcholine, the neurotransmitter at synaptic gap junction, and impede the nerve impulses. So basically, it's a neurotoxin, and it is going to relax your muscle, not going to freeze your muscle. And it's for time limits, like say 4 to 6 months, the effect is going to be there. So after every 4 to 6 months, we need to repeat the Botox. And I will also tell you all about how much Botox is needed, in which lines, how we have to do all that. We will just go through it. So we have indications like dermatological. So cosmetic correction of dynamic wrinkles such as crow's feet, globular or vertical frown, frontalis or horizontal frown, wrinkles on the nose, they are called bunny lines. So if I do like this, I get lines over here. These are called bunny lines. Then upper lip rhytids. I haven't seen so many patients for upper lip rhytids in India. When I was getting trained in UK, I used to see every lady used to have a smoker's line. Means they used to get this lines on the, because they used to do smoking a lot. So females having white skin, and they smoke a lot, and then they develop that lines, they are called upper lip rhytids. Then angle of the mouth, so these are the angle of mouth. When we actually, if you see your face, when we age, our face becomes like this. So gravity takes the aging, and because of that, we will start having the sagging of the all the muscles to skin to everything, and there we get this line which is called DAO. And so these lines, when you get this, it looks like not a happy face. So when you want a happy face, so or if I do little bit like this, it becomes a very nice, a very subtle, change after doing Botox, but it gives a very good confidence on the face. So also we can do on pebbly chin. Now what is pebbly chin? So when we actually, this part of the chin, like this I do, and I get some puckered appearance over here. So if I put some, hardly any 4 to 5 units of Botox, it will relax this muscle, and it will give a nice tight look to the chin, and it will give a good result. Nasolabial fold. So nasolabial folds are the folds which runs from your nose to the labial, means lips. Okay. Then jawline. So if I want a very nice tight jawline, I have to put Botox, very fine units of Botox over here, and then in China and in Japan and all, they have a square face. So they have a very strong, this masseter muscle. This is a masseter muscle. So masseter muscle, when it is very strong, even female, they have face like this. So they have a square face, and for that they come and get the Botox done in their masseter, and I do lot of masseter Botox, and then that gives a very nice look, and it will give you round shape to your jawline. Then you get venous rings, that's horizontal neck rhytids, turkey neck, vertical platysmal bends, but these are all very advanced level Botox treatments done. So basically, when even I train doctors, I train them into first basic, means the forehead lines, then the glabellar fold, then the crow's feet, and the masseter. This 4, if you learn, it's enough for your practice. Also, it is done in hyperhidrosis. So, hyperhidrosis, what is hyperhidrosis? So, hyperhidrosis is excessive sweating in the palms and in the soles and axilla. So, many a times, I have not done so many, but yes, in our colleagues, they have done, and they used to get students who can't write because they sweat a lot. So when they're even writing the paper question answer and all, they sweat a lot and they can't concentrate in the studies. So that's called hyperhidrosis. So they used to come to the clinic to get their Botox done in the soles and palms skin. Then gustatory sweating syndrome, I have never done this procedure, but it's there. Let's do contraindication. So what is, where you should not touch your patient, why and where, and what conditions you should not do Botox is also very, very important. So if a person has an allergy to Botox component, in my 15 years of life, of my practice, I have only one patient Out of maybe I've done 4,000-5,000 Botox and fillers till now, but only one patient had a reaction to the Botox, and she developed that granulomas or whatever you call, and then I had to correct it by calling the allergen people and getting the help from them. So actually only one patient I had it till now in my entire practice. Then if the patient is already having infection, then don't touch the patient. Then you can even neuromuscular disease such as myasthenia gravis, where the muscle power is already weak. If the muscle is weak and you are going to inject, it is going to weaken your muscles further. So don't touch the patient with the neuromuscular disease as myasthenia and Eaton-Lambert syndrome. Then pregnancy and lactation. Obviously, we are not going to touch any patient with pregnancy and lactation whatsoever for any procedure. Okay. Then concurrent use of aminoglycosides, cholinesterase inhibitors, succinylcholine. This all you need to. So when you're doing your Botox, you need to find out a proper history of the patient, of any problems they have, any medical history related to any problem, and the patients with unrealistic expectation. So if I have a patient who walks into my clinic and she's 65-year-old and she tells me, doctor, only by Botox make me look young by 15 years, I can't do it. So that's unrealistic expectation. In that case, I need to do many procedure in combination with the Botox, with the filler, with the thread lift, with the vampire facelift, with all that procedures. So if the person, I happen to get so many Bollywood, and I'm a doctor to many celebrities, I'm a doctor to many stars, but they really have a very, very unrealistic expectation. They want what is not possible. So you have to make sure, so your photography is very, very important in the procedure. Like, you have to show them what all I'm targeting, and it's only that particular area is going to be treated, and you will get result only in that. So if I'm doing this, you're not going to get result for Botox over here. So you need to really tell them. Why are neutralizing antibodies important? So if I get a patient, suppose say I start a patient with 30 years or 35 years, and she keeps coming every 6 months. So after maybe 10 to 15 years, she will start developing actually antibodies, and she will have not very good result with the Botox as she used to get when she was injected first time. So that is one question. Every patient, they will say, अरे डॉक्टर आपने पहले किया था तो बहुत अच्छा रिजल्ट था, अभी तो मेरा रिजल्ट इतना अच्छा नहीं आया. तो 10 साल से आप कर रहे हो, तो you will start getting used to it, and you will start getting the antibodies into your body, and you will get limited effects with the procedure. So what are the available preparations in the market? So we have botulinum toxin A and toxin B. So in toxin A, it's Botox from Allergan. So I generally use Botox from Allergan only. It's distributed in USA, available in lyophilized powder. It comes into 50 units and 100 units vial. It has to be stored in 2 to 8 degrees. Do not store into the frozen compartment of the fridge. You have to only keep it in the fridge in the lower compartment. Shelf life is good if it is unopened. It's 24 months. After reconstitution, it's 4 hours. But I tell you, I've been doing Botox so much, like, I keep patients like when I do my Botox and I open my 100 units vial. So I try and keep 3 to 4 patients at a time and finish that vial. that is the best thing, you get the best result. But I have also used after 1 week or after 10 days also, it is no problem at all. The efficacy is same. But yes, company says you have to follow the guidelines. So toxin A, it's a despot. Now that comes into 500 units. So if your practice is very good and you have, so many patients coming in for Botox, then you can even use this 500 units vial. But I have never used this sport also, and I've never used even MyoBlock because they're not readily available in India. And you have to get order from the vendors there in US and all that. Okay, reconstitution. So each vial of Botox contains 100 unit of neurotoxins, that is point and zero point 0.5 milligram of human albumin and zero point 0.9 milligram of sodium chloride, done with 0.9 preservative free normal saline. Vial is, so when I train doctors like you all, and I train so many doctors. So what I tell them, take a vial in the hand. So when you have a vial, it's same like an antibiotic vial. You will only see the white rim in the down part. And when you actually inject normal saline, so it has to be diluted with the normal saline. So we dilute with the normal saline. I will just tell you how many ml you need to dilute 100 units of vial. And then vial is not like this, you have to mix it, because otherwise you may lose your the vial potency and the result is not going to be good. So we have to take a vial, inject the normal saline, and just very gently you have to you need to just circulate the vial in very slow motion, and not doing like this vigorously. Reconstitution solution can be stored up to 4 weeks. But yes, I have done it more than even 4 weeks, and the potency I have seen is equally good. So this is the vial which comes, it's 50 units or 100 units wala vial, okay? So stability at, of unreconstituted Botox can be impacted by high temperature. So you have to maintain a cold chain when you are taking Botox from one place to the other place, or even the person who is actually delivering the vial to you, you need to actually tell them, if they've come without the storage, proper cold storage chain maintain nahi kiya, so you can actually send them back, because it's not going to be no use for you if you are taking it. So if left at 25 degree, 2.5 days result in only 1% loss of in potency. 13 days result in only 5% loss in potency. But short and sweet, do not keep your vial outside the fridge, and do not even keep it in the frozen compartment. So where we have the ice, don't keep it there. It is stable, it's a very stable product. At 25 degree for 48 hours, it retains the excellent potency. But why take the chance, right? Okay, dilution steps. So draw up like 2.5 cc of saline using a 3 or 5 cc syringe with a 20 to 26 gauge needle. Remove the purple plastic cap and insert the needle through the gray stopper into the vial. So when you just go into the vial, the normal saline will automatically go with the pressure, the negative pressure. And hold the syringe plunger and gently introduce saline to prevent foaming. So you should avoid actually making foams. And that will happen if you vigorously shaking your vial. So don't do that, which may reduce the ability to withdraw all Botox out of the vial. So, and every unit is so very expensive. You don't want to waste a single unit of Botox, right? Factors affecting the potency. So, alcohol in the skin or bottle cap, agitation of the diluted vial, storage of the diluted toxin, that is plus 4 degrees centigrade. Do not freeze Botox once reconstituted. Ice crystal may form which damages the toxin and reduces the potency. Okay. So indications we have, I just told you these are glabellar lines. These are glabellar lines, the forehead lines, the crow's feet, then the neck creases, then the palmar hydrosis, plantar hydrosis, axillary hydrosis. So basic indication global glabellar lines 10 to 35 units. Then forehead lines 12 to 20 units. Then crow's feet you need 12 to 24 units. I will also show you by diagram how many units where you need to inject. But in male patient maybe 3 to 4 units more because the male has bulky muscles. So bulky muscle may need little more than the females. So we all know as dentists and dermatologists, these are the muscles of the face. So the frontalis, procerus, corrugators, orbicularis oculi. So when we are actually doing the crow's feet, we are targeting the orbicularis oculi. And when we are actually doing the forehead lines, we are targeting the frontalis and procerus together. And we also have to avoid going into the lateral part of the corrugators because that may give you ptosis. So we have to avoid that. I will show you how to avoid. Muscle and actions and expression lines. So now frontalis, they are acting as brow elevators and horizontal forehead lines comes from there. Corrugators, they pull your eyebrows medially and you get the frown lines. Procerus and depressor supercilii, they are brow depressors and frown lines and horizontal nasal lines. Orbicularis oculi, brow depressors, and they are used in crow's feet. Pre-procedure workup. So assessment of the patient to explain advantage of limitations of Botox, not to get influenced by patient's demand. So I just had in the morning, my patient, she comes from last 10 years, she comes and gets her Botox done and she is so very smart right now. When I go to the clinic, she's already, in her traveling time only, she applies the pre-locks and she's just ready for the job. So, and then today she said, Doctor, I have these lines. Can you not tackle that lines? I said, no. These lines, if I tackle and I inject here, you're going to get the ptosis and you will get the ptosis of the eyebrow and ptosis of the lid. So do not actually listen to your patient. When you know your anatomy well, you are not going to get influenced by your patient's demand. Photographic documentation is very important. Many a times patient, especially the cosmetic procedures, patient, they forget their own lines when they get the result after 1 week. They say, doctor, ये तो मेरा ऐसा ही था and कुछ ऐसा खास फर्क नहीं पड़ा है. So when you actually show them there before and thereafter, they will know, okay, they now, I cannot lie. Doctor knows everything. Informed written consent is so very important before touching any patient. So you have to inform, you have to take a consent that, okay, I'm allowing my doctor to inject Botox on my lines and this is only for a cosmetic procedure, I'm getting it done. So when you have everything in line, it's not that difficult. Botox technique, Botox given under aseptic condition, ice pack or EMBLA is in anxious patients. But when I last 15 days back, I did my own Botox. I took my mirror, I injected myself. I was training a doctor and she is M.B.B.S doctor. And then I said, okay, you're going to do my left eye and I'm going to do my right eye. So I just took the mirror, I injected myself, and she was like, oh, doctor, really? I said, yes, I do it from last 15 years, don't worry. And then I let her do on my left. So without any prelox, no prelox was actually applied, and EMLA and prelox, and you all use that the spray anesthesia. What is that? Something like spray, you spray and it becomes numb. So
Topical anesthesia.
what is it?
Topical anesthesia.
Okay, perfect. So we use mainly the topical cream anesthesia, which actually works very much better. So it's 35 to 45 minutes before I use it, I apply it, and I just cover it with the, the tape comes with it, and we just make them lie down, have their coffee or tea, whatever, and then I start doing it. So injection given in sitting position with proper illumination. Okay, why in sitting position? Because I don't want my surrounding muscles to get the Botox effect. So if I am targeting only the frontalis, I only want the frontalis to go relax. I don't want the corrugators to be relaxed. So I make sure that they sit in actually not even sitting like this, but in a semi reclining position. So then I know exactly I'm going only into these muscles. Injection sites marked after asking the patient to smile or frown to best demonstrate the site of wrinkles, so that you know exactly where you are going to inject. For the treatment of hyperhidrosis, starch iodine test to mark the problem area and regional nerve block or field block is given. Okay, so 1 ml of insulin syringe with 30 gauge needle is used. So you all must have seen the insulin needle, right? And the needle introduced at 45 degree to a depth of 2 millimeter to prevent backflow of the toxin. So now, facial muscles are very superficial. They are just below the skin. And that is why the muscles, when you're just hitting the thing and you're already in the muscle. And once you do it, it's nice, it's easy to do it. The bevel of the needle should face downwards while correcting the wrinkles and upwards while treating the hyperhidrosis. So in hyperhidrosis, you are not actually targeting the muscle. You are basically targeting the sweat glands. That is why the bevel should be upwards and here it is downwards. Okay. End point while treating axillary hyperhidrosis is formation of a small wheal, and in palms and soles it's blanching. General injection technique tips is change the 30 gauge needle after every 4 to 5 injections. A sharp needle is less painful. So when I do my Botox, I always take 3 to 4 syringes. For my this lines, I will just keep one. Then my glabellar lines, I keep one. Then my right eye, I keep one. Then my left eye, I keep one. So 4 needles or 4, insulin needles I do for upper face. So that it is, patient says, doctor kuch bhi pata hi nahi chala aapne kiya. So it's so painless. It is just like, they'll say, nahi doctor, abhi to kuch kiya nahi aapne. And then I show them the injection mark. Okay, see, I've already done. It's done.
Hey, ma'am.
Yes, any question?
Sorry to interrupt you. Ma'am, I just want you to, speak in English whenever you speak the patient's part, because some of the students are from Egypt. They don't understand our local language.
Okay. I will take care of that now.
Thank you.
Okay. Record the technique thoroughly on a patient worksheet so you can duplicate successful treatments and modify over or under treatments. So I generally do, I do, if they need three units in each site, I start with two units, and then after 1 week or 10 days, I can do a top up. But if I do more, I cannot correct it, right? So I generally start with the two units instead of three units, and it gives a good result. It is equally good. So I always, I don't go according to the books. I see the muscle, and then I take my doses accordingly. Have patients discontinue aspirin and other NSAIDs, vitamin E and ginkgo biloba and week prior to reduce the chances of bruising. In my practice of 15 years, I have never had any patient who is bruising and who's got any hematoma or anything after the injection is done. No patients has complained till now. Okay, hold a gauze pad and in the non-injecting hand so you can apply gentle pressure to any site that bleeds to minimize the chances of bruising. Cosmetic indication, as I just told you, glabellar frown lines, crow's feet, and forehead lines. So factors influencing Botox dosing. Sex. I already told you male and a female. Male needs little more dosage than the females. Ethnicity, dark and white skin. White skin actually ages faster than our skin, and the dark skin, they really have no lines till they are 50, 55 also, they're very tight on the skin. Size of the muscle mass. So I always tell all the students, all the patients, I have to analyze. So if my masseter is bulky, I have to inject more, more units here. And if this lines, the glabellar lines are actually going until the mid pupillary line, I may have to inject one more point over here. So when I inject glabellar line, I inject in the muscle that is like this, the glabellar, the procerus muscle here, and then I take like this and I inject over here. I take one side and then inject over here, and then if the glabellar are extending till the mid pupillary line, I also inject one point over here. Extent of the wrinkles. So you have to see the extent of the wrinkles and do it. Then previous response to Botox treatment. So also ask every patient, have you had any Botox before? So you will come to know what's going to be your efficiency in the Botox. Target muscles for glabellar frown lines. So we are targeting procerus and corrugators. So procerus and corrugators, but we also will take care of not going beyond the mid-pupillary line. You are not going to be lateral from the mid-pupillary line. So my mid-pupillary line only, I will be doing Botox only in this area. I'm not going to inject even if my patient says, doctor, I have wrinkles here. I'm not going to inject because they will definitely tell you, doctor, these wrinkles you've not targeted. So you have to tell them, no, it's not going to be targeted. You will get a result. Wait for 4 to 6 days. The result comes from the Botox is 4 to 6 days. Frown lines, injection site. So this is the red dots are actually, you all see the slides when I change it?
Yes, ma'am, we are able to see the slide.
Okay. So my injection sites, but when I inject, I don't actually mark and inject, but when I train doctors, I let them mark and then inject. But always mark, when you mark the injection site, do not inject on the marking site. You have to go little over or upside or downside and inject, because that may actually give you a tattooing effect. So here the dose range between 15 to 25 units. So I will put, say in the middle point, I will put 3 to 4 units, then 2 to 3 units on the upper side of middle part of the eyebrow, and then I will put 2 units again. So totally it will be ranging from 15 to 25 units. This is the injection technique. So when I'm doing my lines, glabellar lines, I'm going to actually hold my eyebrow like this and going to inject from here, so that I don't want so much Botox to go into the orbital rim and affect there. So this is before and after of Botox glabellar lines after 1 week. So 4 to 6 days you see lines here, and even after the asking them to frown, even then you will not get any lines. Okay, target muscles for crow's feet. So what muscles we are targeting here is orbicularis oculi. So when we are actually targeting this muscle, orbicularis oculi, and that is how you get the crow's feet. Examine individual variation by getting patients to smile and squint fully. Look closely for blood vessels and avoid. The orbicularis oculi is a superficial muscle. Do not need to inject deeply. Only up to 2 mm, not even 2 mm, 1.5 to 1 mm, you can get the orbicularis oculi muscle thing. And then orbicularis, then you inject. Check for asymmetry. Many a times, every patient or everybody of us, when we examine our face in the mirror, we always have a very little asymmetry. One is right is up or left is up, always there. But then in that case, your patient will ask you, doctor, correct my asymmetry. Never try to correct that, because it's not going to be corrected by putting more units in the one side and other side. No. Do same and actually make them realize that your one side is little up and down. So I can't correct only one part, because you're not correcting this part, you're not correcting your lips and all. So it is going to be weird if you put little more here and little less here. Patient at full smile. So when you're doing crow's feet, you ask them to smile. You will see the radiating lines from ear to ear to ear. Okay, that's called crow's feet. So this is patient at full smile, not upper and lower borders of the crow's feet. So these are actually upper and lower borders. So your first point is just the corner of eye, 1 centimeter. So 1 centimeter is only 1 finger away. From your corner of the eye to 1 finger away, this is your first point. So if this is my first point, then 1 centimeter above and 1 centimeter down is going to be my another 2 points. So I'm going to inject all the 3 points. Inject 1 centimeter outside the orbital rim, perpendicular to and into the muscle. At least 3 injection sites 1 centimeter apart suffice. Inject 2 to 4 units of Botox per injection site, depending on the radiating lines. So if I have lines from here to this very down, then I may inject 3 units in 1 point. So that is going to be then 9 units. May add a second outer ring of injections where strong crow's feet extend laterally towards the ear. Injection site should be well above the inferior margin of zygoma. So this is zygoma. You all dentists know your zygoma very well. I don't need to tell you all. Target muscle for horizontal forehead lines, that's a frontalis muscle. So we are going to target the frontalis muscle. Frontal, horizontal forehead lines, careful evaluation is required. Do not overtreat. Leave some facial expression. So now this one problem I have with all the celebrities, they always want expressionless face. They don't want any lines on their face, even on the smiling or on the thing, when they do the movements. And I always tell them that, naturally you need to have a little bit of expression lines because that looks natural. Otherwise, it will look artificial. But they're the one who actually wants, no, I want total no lines on my face. So males have more muscle mass than many females. Look for pre-existing brow ptosis, which the patient may be elevating their frontalis to compensate for. So many a times your patient comes with already ptosis and you need to check that and then treat. Otherwise, you may end up in the complication side that, your patient will come and shout in your office and they'll say, oh doctor, you've done so much wrong and see my eye, now there is a ptosis. But if you actually photograph very well, you will come to know. Look for any brow asymmetry. Approach should be conservative. 14 to 20. So here I have already marked my mid pupillary line. So when you have a mid pupillary line, you are not going to go beyond the mid pupillary line. You are only going to be injecting onto the central part of it, not the blue line. 14 to 20 units of Botox in 4 to 10 divided doses in the lateral to mid pupillary line. Stay one finger above the supraorbital rim. Okay, this is very, very important to avoid ptosis. So here, if you see, you are not going to actually inject onto the mid pupillary line. Say side mein mid pupillary line, you are going to be actually into mid pupillary line. Both the mid pupillary line, you are going to be only into that. Okay, inject only that area to avoid medial paralysis and ptosis. With lateral elevation, Spock look also you get it. Post-procedure care, patient should not recline for 3 to 6 hours. So I have a habit in my all centers. We run 8 centers right now, and we have chain of all the clinics, and we have standard procedure SOPs. Every clinic follows the same thing. So immediately after the procedure, we give them a leaflet, giving them the post-procedure care. You're not going to lie down for 4 hours from now when I'm injected. You're not going to actually massage. You're not going to do facial for 1 to 2, 3 days actually, and then touch up with 1 to 2 units after 2 to 3 weeks of suboptimal results. Procedure is repeated after 5 to 6 months because the results are predictable. Complications. So pain, ecchymosis or bruising, headache, frozen face, ptosis, asymmetric results, weakness of hands when you're doing the Palmer hydrosis, hyperhidrosis, and dysphagia, xerophthalmia. Dysphagia when you're tackling the necklines. Xerophthalmia, resistance due to development of antibodies to botulism toxin, rare. Very rare, but I had one. Potential side effect, ptosis, which is very, very common. If you don't know your anatomy well, you'll end up in ptosis. A consented risk of procedure. So when we have a consent paper signed, we are also taking the consent for ptosis. It may give you ptosis. So we have to actually write it clearly on the consent paper. Usually unilateral, mild and temporary, it lasts for 2 to 4 weeks, can be temporarily reversed with eye drops, which is called Albalon or Allergan, and no refund necessary. Send a gift vouchers or gifts or flowers. Do not refund your money, because patient will come back and saying that ptosis, I've developed ptosis, doctor, give me my money back. You can't. Once you've injected the product, you cannot refund it. Potential side effects: brow ptosis, wait for natural resolution, consider infraorbital injection at arch and laterally to raise brows. Local temporary swelling is very temporary. Upper eyelid edema sometimes occur in Asian patients. Potential side effects: they are bruising. Advise patient to avoid aspirin and all the painkillers and vitamin E and all for 10 days prior to Botox to reduce the bruising. Apply gentle pressure immediately. Then eyes. Headaches and diplopia are rare. Headache is little bit common. Potential side effect is excessive brow elevation. So this is called quizzical eyebrows. Correct with 2 to 4 units of Botox injected into the frontalis 2 centimeter above the lateral brow. So that is correction of the side effect. Overall, Botox is very safe, easily performed, highly effective, provides incredible patient satisfaction. It is also reasonably priced in the realm of cosmetic procedure. It is close to the perfect cosmetic procedure. And Botox is fantastic. I've been taking my Botox since last 15 years. I inject myself. I don't need any injector to inject my Botox. So Botox, if you all have any questions, we can take the questions after we finish with the filler, right? Okay, so then
Yes,
we
ma'am.
go. Okay, thank you. We go to the next lecture, that is called filler.
किसका हो जा रहा है वो
Okay, we start with dermal fillers. Yes. Yes, let's start with the dermal fillers. Okay, so as Botox is a very good procedure, even fillers, they are also such a good procedure. You can actually, Botox and filler, the difference between Botox and filler is Botox is used for upper face and the filler is for down, the lower face. And Botox takes 4 to 7 days to give you result, but filler is instant. So filler, I do it and patient loves it. They say, oh doctor, you've taken my 5 years from my face. So that's the best part of the filler. Okay, what are dermal fillers? So let's just go. Okay, history. The filler is coming from human beings have used personal cosmetic enhancement for thousands of years. Initially, fat was grafted to fill volume after trauma. So, in the 20th century, autologous fat became the most common filler. However, cutting out the fat and transplanting it still represented a major procedure, and in most cases, it did not have lasting effects. In 1970s, research into collagen production produced a bovine formulation that could be placed in a syringe and injected. The temporary nature of bovine collagen and the requirement for double skin testing led to the development and testing of other fillers in Europe and Asia in the 1990s. As we age, we start developing the nasolabial fold. So this nasolabial folds can be corrected by if we put the collagen back into our skin. So as we age, we all know that as we age, our collagen depletes in our skin and we start getting the lines, that is nasolabial fold. So main procedure or filler in 90% of the patients indication, first indication is nasolabial fold. So fillers could be used as a sculpting agents to dramatically change a person's appearance in a mere 15 minutes. Again, so there are many patients who actually come with the Prelox on, and I start injecting immediately Botox and filler. My procedure is done within 30 to 40 minutes. It's done. Fillers could be used as sculpting agent to in 15 minutes. Today there are a number of fillers to choose from, each with its own strength and drawbacks and indications. So patient's aesthetic evaluation. Any line of facial expression become accentuated with the age, muscular hyperactivity and volume loss. Now, even I get lot of patients getting the cheek enhancement with the volume up. So we put in volume back. So as we age, I told you this becomes very like this. So even you lose your malar cheekbones, nice fat, we lose with the aging. So we put in back that and it becomes very nice and it like changes. Then you must all have heard about Leonardo Vinci divided the face into into thirds. Like see, from your chin to nose, nose tip to the mid eyebrow, and mid eyebrow to the hairline. So this three should be equal. But when we age, this proportion becomes haywire. So that time, you will start getting disproportion in the three part of the face. The upper, middle and lower face must be in harmony. The appropriate filler can restore symmetry, volume and recreate a smooth surface. In combination with other treatments such as Botox, they may lead to more enhanced aesthetic and longer lasting results. Indications for facial defects: either filling pre-existing facial defects or augmenting existing facial structures. Upper third of the face. So filler, if I tell you just in one line, filler is used for static lines and the Botox is used for the dynamic lines. Dynamic wrinkles and static wrinkles. Dynamic wrinkles means the wrinkles which comes on the movements. They are called dynamic wrinkles. And the static wrinkles means they are without any movement. When you age, this part becomes prominent and you start losing these lines. Well, you have very deep lines and that makes your skin or your face very aged. So we start doing that procedure. We start actually filling in that area, giving the youthful look. In the periorbital region, low viscosity fillers may be used for etched in-crow's feet, particularly those that extend inferior to the inferior orbital margin. Effect of the malar eminence, scars resulting from trauma and acne. I have done so many patients with the deep scars, acne scars also. We actually filling those scars with the filler. Nasolabial folds, also known as smile lines, the NLF cross the transition zone between the mid face and the lower face. Mid face, the appropriate use of a filler can remove the double bubble between the lower eyelid and the upper cheek. That is also called tear trough. This area particularly, when you get the sunken eyes or a deep-seated eyes, you start getting the groove over the area, and then you don't like that because it is like deep sunken eyes and it is always tired look. You don't have a fresh look. So patient comes with that procedure also, and they say, doctor, I don't like my this part of the face, and can you do something about it? So we can correct it with the filler. Fillers create a more uniform smoothness in the transition between the upper mid face by effacing the tear trough deformity. The subject promptly loses the tired appearance caused by the dark circles. Lower face, angle of the mouth. The lower face is denominated by vermilion lips, both in contour and profile. So we all know that even when we age, our lips starts getting thinner. Now, when I used to be doing very many patients with the lip filler, in UK, I used to do only with the aging face because they had a very thin lips. But in here for Bollywood and Hollywood and all, they like the pout of the lip. And there for that case, I do the lip filler for the pout look. But in UK, I used to only do mainly for the thinning lips to give that volume back, and then it used to again give this volume and it used to look good. Pre-procedure planning. The patient should not take, again, same as Botox, avoid aspirin, vitamin E and anti-inflammatory drugs and all that. If the patient is on Coumarin, the prothrombin time should be checked. So you need to take the history of the patient properly. Are you on any anticoagulants or are you on any drugs? So you need to check then prothrombin time. Then the risk of hematoma or excessive bruising from injection is low. Then photographic documentation in any procedure, we really need that. And return informed consent. Ideal filler. A dermal filler is a natural or a synthetic material used for injection in the dermis for augmentation of soft tissues. So it should be natural or synthetic material, but it should look natural. It should not be lumpy and all that kind. An ideal filler should be safe, non-toxic, non-carcinogenic, and not long-lasting, not too expensive. Mechanism of action. All filler work in one of the 5 ways. They occupy the space, they produce little inflammation, they bind with the water, they induce a scar formation and promote a wound healing response. Okay, classification of fillers. Fillers can be classified either on the basis of longevity in the tissues or based on their sources. So fillers can be classified as temporary, that is for less than a year, semi-permanent for up to 1 to 2 years, and permanent more than 2 years. But generally now in our dermat conferences when we go, people stop using this permanent fillers because they used to give lot of granulomas and permanent, the lumpy dumpy appearance. Classification of fillers based on site of placement. So there are dermal fillers, there are subdermal fillers, and there are supraperiosteal fillers. Based on origin of filler material, they are heterograft, allograft, autograft, and synthetic material. Temporary fillers are non-permanent fillers for less than 12 months. Advantages of spontaneously disappearing if the patient is not satisfied with the results. Some of the common temporary fillers available in India are Zyderm, Zyderm 2, Zyplast, Cosmoderm, Cosmoplast. Characteristic based on examples, based on content, collagen based, they are Zyderm, Zyplast and Fibroquil. Fat, we do lot of liposuction also in our practice. So many a times patient is aged and we are removing the fat from by liposuction. So we take their fat and then we actually start, we centrifuge it, and then we make a syringe and inject back with the syringe onto their face to give them a nice, so that's their own autologous fat, and that works very well. Even we've done many patients with the breast also. Means we've taken out the fat and we inject into the patient who's got a very small breast, we inject the fat. So that is also called autologous fat transfer. Then hyaluronic acid, then silicone, Hyla gel, Hyla and Restylane. In India, Restylane is one which is easily available, and that gives you, hyaluronic acid is mainly for moisturizing. So it gives you nice moisture to your skin. Silicone based, I have not used any of them, but they are there. Biocell Ultraviolet and Silicone 1000 and all. They are only available in Europe and US and all. Uh, uh, you know. Then temporary Zyderm, Fibril, Leloderm, Restylane, autologous fat. How temporary, we don't know the effect, because autologous fat, many a times we do it and after 1 month or 2 months, a patient says, doctor, there is nothing on my face now. Again, I need one. So that is why we don't generally do it as per procedure. But if the liposuction is done and patient wants a little bit of, recontouring, we do it. So Restylane, Sub-Q, Touch, Vital, lips enhancement, Perlene is basically Perlene is more permanent filler kind. Perlene and Aquamid. These two were available in India, which are actually permanent fillers. I have done few of them, but I am not very happy with the result, the permanent filler gives you. Semi-permanent fillers undergo slow degradation with the time over period of 1 to 2 years. Side effects with semi-permanent fillers are more common and longer lasting than temporary fillers. So basically, when you are starting the practice, I suggest you only do the temporary fillers. Permanent fillers are fillers that remain for longer than 2 years in the tissue. Side effects with permanent and complication is the main issue with the any permanent filler. So when you injected the permanent filler, you can't actually remove it even with the hyaluronidase or something like that. But the temporary filler, when we actually inject the hyaluronic acid, it will dissolve the Restylane and Perlene. Restylane is a FDA-approved non-animal stabilized hyaluronic acid derivatives used for soft tissue augmentation. And 20 milligram per ml Restylane has a higher concentration of hyaluronic acid than Hylaform gel. Hylaform gel, we don't use it in our practice. We only use Restylane. Technique of filler. Now, having the patient position sitting up will be enable an accurate assessment of the defects or lines. Applying the topical anesthetic again at least 10 to 30 minutes prior to the procedure. For infraorbital and submental nerve blocks is often indicated. Surgical procedure, preparation of the part, topical anesthesia, implantation material available in pre-filled syringe. So these are pre-filled syringes. Botox is not pre-filled. You have to make your own Botox. Here the syringe comes pre-filled. There are some now allergan people have also started with the lignocaine. So the injection, while you inject, lignocaine is also there, and the pain is little less than what we are using the normal one. Implantation material available in pre-filled syringes is injected in the dermis with 32 gauge needle. The bevel surface should face upward. So now You need to remember in Botox, the bevel should be downwards, here the bevel should be upwards because you are actually filling in the lines. The bevel surface should face upwards and the depth of the injection depend upon the nature of material you use. Highlines and all, I'm not going to go very much in detail because we don't use it. Material is injected in the serial puncture, linear, threading, fan, cross-hatching or sandwich technique. I use the linear technique. So I go inject, come out, inject, come out, inject, and I inject while coming out. So that is much better and the distribution is much better, and then you can always massage it where you have actually deposited the filler. Bend the needle at 30 degree, then it is parallel to the skin surface without any blanching. Inject while withdrawing to reduce the risk of vascular injection. So when you are injecting your first injection, you should withdraw and see if there is, if are you in vascular plane or are you in the normal plane. The area is massaged lightly to mold the material and avoid the lump formation. Linear threading technique, the full length of the needle is inserted in the middle of the wrinkle and the substance is injected while pulling the needle slowly backwards so that the threads of the gel are placed lengthwise in the wrinkle. Several successive threads below, above, or beside a precious injection may be required to fill the larger folds, lines, or wrinkles. Serial puncture technique, easiest. Multiple. That is what I do. So, multiple injections are placed serially along the line of the treated wrinkle or a fold. It is often preferred by beginners. It is important not to inject too superficially, as this will result in lumpiness and possibly in an increased incidence of granuloma. Too deep an injection will result in a less than desirable augmentation. So you need to be exactly in the plane where it is needed. So if you go deeper, you will have no result. If you are superficial, you can develop a granuloma or a the lumpiness. Injecting into the lip requires a great degree of finesse and judgment. I have been doing the lip filler last 15 years and not a single patient I had a hematoma on the lips also. Fan technique, the needle is inserted at the periphery of the area to be treated as when using the linear threading technique. After injecting one line like this, then I go with the needle in only, I go like this, I go like that, and I start injecting while coming out. Okay, cross hatching technique, I don't do it, but the needle is inserted at the periphery of the area intended to be augmented and injected as when using the linear threading technique. The needle is withdrawn from the skin and inserted 5 to 10 nanometer adjacent to the first puncture site and injected in the same way. This procedure can then be repeated at right angles to the original lines. These are the diagrams where we are doing the linear threading technique, serial puncture technique, fan technique, cross hatching. Many practitioners prefer the threading technique. The advantage of this technique is that there are fewer needle punctures and potentially a smoother result is obtained since it is easier to produce contiguous layering. In contrast, the multiple puncture technique requires several needle sticks. The advantage of this technique is more control and precise placement. Some practitioners enter the skin with a needle angle of 30 degree or 45 degree. Others prefer it more parallel to the skin. It is really a matter of personal preference. So when you start injecting, you will come to know how you are comfortable, in what plane or what degrees you are comfortable with. A rule of thumb to gauge needle depth is that for mid-dermis placement, the needle contour should be visible, but not its color. guide treatment while injecting by visual response with thinner material placed high in the dermis like Restylane fine lines, and tactile response while when placing thicker material more deeply. Resistance should be felt placing the thicker substance into the deep dermis. A sudden drop in the such resistance may indicate injection into the subcutaneous plane. The most difficult part of the technique for beginner is developing a feel for the needle depth. Approximately 20% overcorrection can be massaged out. More will lead to a persistent unwanted cosmetic results. Measure to achieve successful outcomes. A comprehensive treatment plan should be devised to suit the need of each patient. Choosing the right filler for the right indication is vital, where essential combination of fillers with botulinum toxin should be used to optimize the results. So I generally combine Botox and filler together to give my patients the best look. So I have patients since last 15 years. They are only coming to me every year. They take their appointment 1 year in advance and they actually come. So it's the best procedure to do. You get such beautiful comments while, after they've done, they feel wow. Best part of Botox and filler is nobody is going to see a drastic change, but you will love yourself in the mirror. This is what matters with the Botox and filler. In such cases, like, you see that confidence on their eyes. Wow, it's nice, doctor. I love it. Okay, in such cases, so optimize the result. In such cases, it is advisable to inject the botulism toxin first, wait for a week to see the improvement, and then inject the filler to achieve best results. But when I'm doing the upper face and lower face, I combine both at a single session. I have patients coming from all over the world for Botox, for fillers, for threads, for Cosmelan, for lasers, everything in one go. I have done. And no problem at all. But you need to know what you should do first, what you should do second. Okay? Post-procedural precaution and advice, touch-up treatment can be given after 2 to 4 weeks if necessary. Avoid exposure to extreme cold or heat. Avoid massaging treated areas for 6 hours. And avoid strenuous physical activities for 6 hours. Pain medication can be taken if needed. Resume skincare products such as retinoids, alpha hydroxy acids the day after the procedure. So 1 or 2 days gap you have to give. Storage issues, shelf life is 1.5 years from the date of production, stored at 2 to 25 degrees. So even filler, if you put it outside in your office, it's not going to go, but it is better to keep it in the fridge, not on the frozen compartment. Combination approach, sandwich procedure. Here, where one product above the other in different planes for a better aesthetic effect, like Perlin and Restylane, Botox, laser resurfacing, peels. So I generally, basically, I combine many procedures depending on patient sensitivity, depending on patient's budget. Because if they don't have money to do, because if I do Botox, filler, threads, Cosmelan with a skin peel and all, my budget is going to be per patient, it is going to be more than 2 lakh rupees. Yes, so if they have 2 lakh rupees, patients from abroad, they generally compare the price from their own country and they feel it is nothing. So I do it at one go, all the procedures. Complications like bruising, pain, discoloration, infection or necrosis. In my practice, in last 15 years, I've never had any complication with the filler. No necrosis I had ever had, no granulomas, nothing. So if you know your product well, if you know which country, but got the filler done, especially this filler when you're doing tear trough and all, it usually resolve over 2 weeks or 1 or 2 weeks without the therapy. Massage may expedite resolution of this problem. True granulomas are rare and can be treated initially with a low dose steroid injections. Larger or persistent granulomas may need to be excised. Procedures: temporary fillers have fewer complication and transient adverse effects when compared to semi-permanent and permanent fillers. Adverse effects could be injection related or filler material related and may appear either immediately or later. Advantages: instant result. That's the best part of filler. I love fillers because my patient sees the line, it's gone after I do the procedure. And they say, wow, one of the patient I had in Goa, and I have a clinic in Goa. So one foreigner came 3 years back and I did her Botox, fillers and threads on the same time. And when she actually she seen her face in the mirror, she said, my God, doctor, I look like my daughter. That's the best compliment. Means she said, and she immediately video called her daughter, and her daughter was saying, wow, mommy, what have you done? You're looking so good. So that is the power of Botox, fillers, and threads. No downtime because it's just instant. Easy procedure, does not require special surgical expertise unless until you get trained very well, you can do it. And this procedures can add 3 to 4 lakh rupees per month into your practice if you do it well, if you market your procedures well. Disadvantages: it's expensive. So the filler, the Restylane or whatever, the Botox comes in by Allergan is almost around about 18,400 units. Okay, and filler pre-filled syringes by Allergan again comes at 18 to 20,000 rupees for one syringe. So even your product cost is higher, but if you do it, I charge almost 25 to 30,000 per syringe for a filler. It's just half an hour job for me. And I charge 350 to 450 rupees per unit for Botox per unit. Temporary results of fillers needs repetition about once a year. Chances of adverse reactions. Chances of adverse reaction, I have not seen any, but yes, it is there. So that's all about Botox and fillers. I hope you all enjoyed my lecture.
Yes, ma'am. Ma'am, there are some questions on the WhatsApp group and the YouTube. Now, should I start with the questions now?
Where can I see them?
Ma'am, I'll send them in the. Ma'am, I'll send them in the chat, ma'am. You're in the Zoom chat box. I'll send them in the chat box, ma'am.
Okay.
You can either read or should I read them for you?
Yeah, please read it for me.
Ma'am, the first question is: can we repeat the filler at the site which was previously injected 1 to 2 years in case of temporary fillers?
Can we repeat the question, please?
Can we repeat the filler at the site which was previously injected 1 to 2 years ago in case of temporary fillers?
Yes, you can. No problem at all.
What is better, Botox or dermal fillers?
Okay, nice question, but the answer is both are equally good. To me, both are equally good, and it is treating both the things differently. So now you need to analyze your patient and ask them, okay, what is your concern? So if my patient says, oh doctor, I've got these lines and I want to tackle, then for me Botox is better. But if the patient comes with the nasolabial fold, I'm not going to do Botox here because it's not needed. She is concerned only for the nasolabial fold. So I will then definitely do the filler.
Next is, ma'am, the question is, ma'am, about the previous question that whether it can be repeated or not. It's asked if yes, then how many times can we repeat the temporary fillers?
Temporary fillers has the shelf life of up to 1 year. So now if my patient comes back to me in 8 months or 9 months, say many a times what happens if you do vigorous exercise and all, you may lose your fat, or you may lose, the gravity and all that takes the toll on them, and then they again start developing the line. So the perfectionist patient needs to come back to 8 months or 9 months, they'll again get it done. I can easily do it.
Ma'am, when you say that it has a shelf life of 1 year, ma'am, that is in the patient 1 year or like on the shelf 1 year?
No, on face it is 1 year. So up to 1 year. But I'll tell you, none of my patient comes back to me with 1 year. Oh, doctor, I've again developed the same line. So once I do the procedure, maybe 1.5 year, they'll come back to me. Okay, doctor, I want to get my Botox and filler done again.
Ma'am, next one is, can we repeat the part that is related to the dark circles?
Can we
repeat the part that is related to the dark circles? Ma'am, someone wants you to repeat the part you talked about.
The tear trough I told you?
Yes, ma'am.
Okay, tear trough generally it stays for 1 year. Don't repeat it again and again within 3 months or 4 months. It's not needed. But yes, if again there is a sunken eyes, and again there is a vigorous weight loss and all, you may repeat. But in tear trough, you may hardly require a very small volume to do that tear trough.
Doctor, I have a question.
Ali,
I've heard that.
Ali,
Yes,
you are from?
from Egypt. Yeah.
Okay, wonderful. Tell me.
So I've heard about Botox treatment for migraine, like patients
Yes.
with migraine. So
Right.
can we shed light on it?
See, there are indications, and cosmetic migraine also is treated. I don't do it, but yes, many doctors are, in India, we only stick to our department. So it's like, I do only cosmetic Botox. I only do cosmetic Botox. I don't treat migraine patient. So I don't do the migraine Botox.
Mm-hmm.
So I have no idea about it, but I can find it out for you from my colleagues.
Okay, thank you.
Yes. Any more questions?
I'm just waiting a minute. There are a few coming up.
Yeah.
Ma'am, it was a really amazing lecture and it was so helpful, ma'am. Thank you so much.
Thank you very much. No, you all were a good listener. Huh? Nice. Because I was little dozing in between. I was thinking, my God, I need a coffee. I got one coffee. But you were all listening very nicely.
Thank you so much, ma'am, for such an meaningful and amazing lecture.
It's my pleasure. Always to get associated from everyone. And it's nice. How much is the Botox and filler treatment in USD? Okay. So in USD, it is, let me calculate. Filler may go round about $250 to $300 mostly. Let me just give you exact figure.
How much in Indian? Like in Indian
In
rupees?
India. In India only I'm talking. I'm talking about India. So I charge 25,000 for a filler, which is divided by 75 maybe. So that is $333 I charge for one syringe.
Mm-hmm. 1 unit.
Depending on the patient. If patient is nice, and good paying, then I may charge even 400. It's
Plan to come to
that's the
India to get your
different
Botox,
case.
Ali?
Yeah?
No, no,
Ali,
no.
come down. I will do your Botox and filler.
Okay.
You don't need it. You
I
need
need it for
but
my
crow's
migraine.
feet. You're developing the crow's feet, but I can see that.
Yeah, I actually like them, but I ask about the Botox because I
Migraine.
have a migraine.
Okay.
I have a chronic migraine, so
Oh,
yeah.
okay. But Botox, there are many doctors doing for migraine. I will find it out, and you are already on the group. I will definitely give you that, details.
Thank you so much.
Ma'am, the next question is why should people get Botox at a dentist's office?
Okay, so now if I started my lecture with that only, that Botox, fillers, threads, or whatever I practice right now is not a part of any books. No university is teaching you. So it is the separate field on its own. But in India, you've heard the name Dr. Mohan Thomas.
Yes, ma'am.
Have you heard? He is the
Ma'am, I've
dentist.
heard.
He is the dentist, and he is number one surgeon right now in India. He charges for Botox not less than 500 rupees, and he is the celebrity doctor. So it's not anybody's field. It's the confidence, and if you know your subject well, you can very well do it in your clinic. Many of my dentist friends, they have started incorporating Botox fillers into their own practice, and that just by adding Botox and filler into your practice, you can. I just told you, you can actually have 2 to 3 lakh rupees difference per month into your practice, because it's such a field. Patients will never say no for all this, because they know that okay, if I want to get my Botox or filler done, I have to spend. So I don't have any patient who is poor and coming to me as Botox and fillers. So I already have rich public coming for the Botox and filler.
Ma'am, the next question is why do we dilute Botox?
Because the Botox itself is the white crystalline medicine, the crystals. Why do you dilute your antibiotic? Give me answer for that.
Ma'am, because when it's injected, it's in the crystalline form, so you have to.
Correct. So that's the question. That is the thing. So you have to dilute because it is coming in the white crystalline powder form. So to make Botox, you need to dilute with the 2.5 cc for 100 units vial. Then only your Botox is made. Then only you will be able to inject 1 unit, 2 units, 3 units, like that.
And the next question is what is the protocol for a Botox treatment gone wrong?
Protocol for Botox treatment gone wrong. If you've heard the lecture, major problem with the Botox is only the ptosis. So I had even given the name of the eye drop, Alabron karke, you get that kind of an allergen. That kind of eye drop comes, you can start putting into your eyes and it will reverse within 2 to 4 weeks. That is the major complication of ptosis gone. Ptosis is the major complication of Botox gone wrong. Otherwise, your bruising and your all that hematoma and all, it will get resolved by its own. But only thing ptosis, you need to put the eye drops.
Ma'am, the next question is can you tell us more about the therapeutic uses of Botox?
Therapeutic uses of Botox, it's a poison. So it is also used in the palsy, Bell's palsy and all, but in a very large dose, like 500 units they use for all that kind of procedures. Again, I'm not trained into all that, and so basically I don't know so many. I only know my subject very well, cosmetic Botox.
Ma'am, the next question is, can you tell us more about the cons of working with Botox, short term and long term?
Botox, I had also told in my slide that if you keep repeating your Botox every 4 to 6 months for 10 years to 15 years, then your efficacy of the Botox or your lines will not get vanished how it is done first time. Okay, so your body starts developing the antibodies, and thereby the result of Botox is not seen as you're doing for first or second time. You are not going to get that kind of result.
Are there any more questions? No, that's it, right? Ma'am, just a minute, I'll cross. Ma'am, there's one more question. Ma'am, how can you do a Botox treatment and make it look natural?
See, we are not freezing the lines. That's what we are not actually basically giving. And I practice like instead of three units, I only do two units and relax those lines naturally. I don't like that plastic look on myself also. So I definitely don't want my patient also to look like a plastic. But we have some celebrities and we have some Tollywood and Bollywood people. They always want little more. So I tell them, no, I'm not going to do so much onto this first time. When I do the top up, if I require to do it, I will inject some for more units, but not at the same or single one session. First session, I always go a little less.
I think that's it. Those are all the questions. That's it, right? Yes, ma'am, those are all the questions. Thank you so
Okay.
much for the lecture, ma'am. It was very informative. And since you're all students now, we're all very eager to, learn more about Botox. How is it done? Because it's
Sure,
always in the
anytime
news.
you can contact us for all that. No problem at all.
Thank you, ma'am.
Okay? Okay, bye-bye.
Thank you, ma'am.
Bye.
Oh, ma'am, thank you, ma'am.
No problem. Bye-bye, dear. Bye.
Someone has to take a picture, right? Or did